If you or a loved one becomes ill or injured, knowing the patient's medical history is crucial for doctors to provide effective treatment. But what if your family member is taken to an emergency room and is unable to communicate with the staff there? The consequences, well, they could be deadly. And that's why healthcare organizations across the state have teamed up to make sure that your health is not compromised. And here to explain that from eHealth is Dr. Angelo Carrabba. Thank you so much for being with us today.
Thanks for having me.
All right, the big question, what is eHealth?
eHealth is an organization of healthcare providers that have come together to ensure and grow the health of the state of participants in the state of Connecticut. We hope to get data available to folks in the emergency room that is extracted from their patient charts in their physicians' offices, also from hospitals and other ancillary services that the patient's taken care of.
This could be crucial in saving someone's life. So give us the backstory about this. How did this come to be?
This came to be as the healthcare community realized that there was a need to ensure that the appropriate amount of information is available to the practitioners at the time and at the point of service. We've become such a mobile society that it is important for us to have that information available to the caregivers at a given moment. Unfortunately, the availability of electronic health records hasn't grown to the proportion that we'd like to, but I would anticipate that over the next couple of years we'll be able to have the majority, if not a good number of physicians using electronic health record and us having the ability in the state of Connecticut to retrieve that data and have it available to other healthcare providers.
So break it down. How does it work? How would a consumer be able to begin documenting their health history?
Well, there are several ways. Some of the health plans and some of the commercial providers, Google and I believe even Walmart, have health records that the patient can generate themselves. The way that I think most practitioners feel is most reliable is for them to have the electronic health care record in their practice populated, and then as that information is needed, it can be retrieved from those particular practices or institutions.
Now, I'm going to guess, aside from the emergency room, this would be extremely beneficial if you were caring, let's say, for an elderly loved one somewhere else.
Correct. Often people will come to an emergency room and say, what's the list of medications that your mother has or your father? And they'll rattle off, there's 2 yellow ones, there's 1 white with an orange band, and so on. This would allow the doctor to, or the healthcare providers of whatever stature, to understand exactly what those pills are, not this descriptive presentation of what the pills are.
What about the privacy issues involved? Can people be assured that their privacy can be maintained?
Yes, it's all going through a very secure and encrypted process. This isn't going to be stored at a central location. This is going to be within your own practitioner's practice or within the institutions that you get your tests done, and there's a lot of security to that. Also, that the patient has to opt into the process of having their information available.
So how does the general public, or what do they need to know about the cooperative?
Well, the cooperative that we've established over the past couple of years is a unique organization in as much as it brought together a number of health care professionals, and it looks at the quality of care that's given to patients. It is under the auspices of eHealthConnecticut, which is a non-profit. It includes the Connecticut State Medical Society, Connecticut State Medical Society Independent Practice Organization, and also 5 major health plans, and Qualidine. Qualidine is a healthcare consultant organization and research organization.
So many healthcare providers.
Correct.
If you are a consumer or a patient and you want to get involved in this, what's the first step?
Well, I think always a discussion with your physician is important to get a sense as to where they are with regards to having electronic health records available, their take on you having a personal health record located elsewhere, and how you can help integrate in that eHealth record so that the data is accurate, that it is available, and that you're a willing person to partake in this program. I think that, we've come to use our debit cards pretty securely, and I think that you're going to see the same level of security, and patients should have the same level of comfort that they do with use of debit card information.
And quickly here, when do you expect that we could get this online?
Hopefully the part where it's available in hospitals and in emergency rooms and in other doctors' offices, probably about 2 years away. But the quality initiative that we had started out with, the information is now out there for the physicians to look at their results, to compare themselves to their peers in the state, and also to a national benchmark.
Dr. Caraba, thank you so much. Some very important information. We appreciate you joining us. And for more information, just go to our website at WTNH.com, click on Connecticut Style. We will have the link there for you.